Hello, I'm Ushma Neal with the Journal of Clinical Investigation series, Conversations with Giants in Medicine. Today, I have the pleasure of spending the next hour with the neonatologist and pulmonary biologist, Dr. Jeffrey Whitsitt of the Cincinnati Children's Hospital. Whitsitt defines the term physician scientist. His research has provided the understanding of pulmonary surfactant biochemistry and structural biology that underpins the widespread application of surfactant treatment for neonatal respiratory distress. He's been called the godfather of neonatology and has built the peri and neonatal program at Cincinnati Children's into the best of its kind. Thank you so much for joining me today, Dr. Whitsitt.
Thanks for having me.
Do you think you could start by telling us a little bit about your family and what you were like as a child?
I had trouble sitting still. Had an Appalachian family in the South, grandparents, essentially farmer blacksmith type, in southern Tennessee. And so I grew up in the country, spent my summers chasing snakes and lizards and getting chiggers, and growing up in most of my family from northern, around Cleveland. I spent my summers in the South and my winters in a small town in northern Ohio. Quite rural. I truly walked to school uphill, but coming back, it was downhill.
What did your parents do?
My father's an artist and teacher, but mostly portrait painting. He ended his career in England for 20 or 30 years, painting portraitures and playing guitar and music. So I grew up in a home full of art and music.
Did you have siblings?
I have a brother, and he's a fine guitarist, but he's also a physician, and he lives down the street, and he is a fine emergency med doc in the community, but he really likes playing guitar.
So as a child, were you competitive? Were you sporty? Were you academically minded?
We lived in a rural community. There were only 50 or 60 children in our high school, and then later in high school, several districts came together, and so I grew up in a very small community. Most of the folks didn't go to college, well, we had a bowling alley in our town and a supermarket, and that was about it. But I lived outside, worked on farms, enjoyed wildlife and a rural community. It was not pressured. I didn't worry about tests and took the bus, and it was a real Midwest country life.
Did you show any academic achievements starting maybe in high school?
Oh, I was okay. I placed top of the state in many of the testing. I didn't study. I don't like, I was just lucky. And so I did fine academically without having to work very much. I had fantastic teachers. It was after World War II, and I had great physics, math teachers, and chemistry. And so even in high school, I somehow had a fervent belief in science. I remember sitting on the porch with my father when I was 7 or 8, and Sputnik was going over. My dad had been a pilot in World War II, had his own plane. And we talked about it and saw this thing going across the sky and said, you know, science is really something we can understand life on our planet. And so my dad was a dreamer, and I can still sit next to him.
So what was it that put you on a trajectory towards Colgate University to study chemistry?
I can be bought. They had a program called War Memorials recruitment, and I was a War Memorial Scholar, in which they brought probably underrepresented communities, and I had a full scholarship to Colgate. I had to work serving food and stuff, but I had a full scholarship, and it really brought a group of us from smaller communities to New York.
So tell us a little bit about that time. Did you get more of an exposure to science? Did you get any exposure to research during that time?
Since 1965, I've never left a research lab. All through my career, I somehow ended up in a laboratory doing something. So it was particularly, I was teaching natural history in a camp for children and giving hikes and stuff. And one of the parents' weekends, one of the parents was Bob Haynes, who was an MD PhD from WashU, who worked at Cleveland in pharmacology. And that laboratory was Ted Rall, Varner, where they got the Nobel Prize for discovering cyclic AMP. And so as a high school student, he said, why don't you come and work in our lab? And so I did. And I kept summers every January off. I was always in his lab or associated labs. And all through Colgate, I spent summers in labs. And I just was fascinated, recurrently excited and fascinated with science. So Bob was a fantastic person. Mitochondrial science before it was popular. And I stayed in contact with him all through my career. Each time he ended up in Charlottesville, and he ran the department there in pharmacology for a while. I got to wash their pipettes essentially and was proud to do it. But if you drop a 10 lambda pipette in those days, that was big trouble.
So the early exposure was more biochemistry. Like, what put you on a path then towards studying chemistry?
Linus Pauling, to understand chemistry, when molecules interact and have to interact, thermodynamics, just absolutely clear and exciting. And so understanding how molecules fit together and have to fit together, energy states, really defines structure, and then ultimately defines the machines that make our bodies work. So I think it was Linus Pauling's book that simply said, if you understand these pieces and put them together, you'll understand a lot about the universe, but also about why the machines that we have in our bodies work.
So at what point did you decide to go to medical school and pursue being a physician?
Well, I did advanced chemistry. It was a very small cohort. There were 12 of us, I think, by the fourth year, and met a man named Joe Thurner. And he told all the pre-meds, look in front of you, to the side of you, and behind you. All those people will be gone by the end of our courses. Because you're going to drop out. And about 12 of us didn't at Colgate, and we all became physician scientists. And he was just an incredible role model and just a fine teacher who just really let us know that we were never working to our full capabilities. I remember when I graduated, he said, Jeff, you just don't know your limitations. And I didn't know if that was a compliment or he was really telling me I wasn't very bright.
Well, clearly you were, and you transitioned to New York City and Columbia University for medical school. Did you go thinking, I'm going to continue to do research, or that you had an impetus to become a physician?
It was an interesting time politically. At Columbia, closed the school down the first year when we bombed Cambodia. A lot of us left for a month and were active politically. And it was really do a PhD, do an MD PhD, or get an MD and then do science later. And it was actually Bob Haynes said, you know, you'll always be in good stead in the background you get as an MD. We'll put you, if you want to do science, you'll be able to do science as long as you love it. But it always gives you a strong footing in biology and in medicine that will enhance science in the end.
So if you had some choices, it seems a interesting trajectory to go from rural Tennessee to New York City. How did you choose Columbia?
They gave me a scholarship. Unheard of in those days. Nixon was still president, and there was still some scholarships for medicine, and I was able to get through. My family couldn't support me, and I worked in genetics, counting chromosomes at night, and I worked in laboratories taking blood from steroid circadian rhythm and recess at 3 a.m. And so I got my hand into research all through medical school, and really enjoyed it. But the only award I got was for community medicine.
If you were driven by both research and community medicine, where was the tipping point towards pediatrics or pulmonary biology and neonatology?
My first year in medical school, I made rounds with Stanley James, and he worked with Virginia Apgar. And I made rounds in OB with Virginia Apgar of the Apgar score. And I had enough basic biochemistry and understanding of biology. And morbidity and mortality was so ever present in newborn medicine. We couldn't take care of children who couldn't breathe. We couldn't give them nutrition if they couldn't eat. We couldn't keep them warm. The tools for adult medicine didn't really support babies as they should. But I knew enough about biochemistry and physiology to say, oh, there's a huge opportunity here. And we've got to bring science into this area of medicine. And we did. And it was just fantastic.
So was it during this time that you then decided to stay in New York City and move over to Mount Sinai for your residency?
At that point, I wanted a really firm grounding in clinical medicine. It was just clear as a bell. And in those early days, if you took meticulous care of some of these premature babies or challenged babies, you could get them through. And they were hopeless cases. And yet, with careful management, you were able to break the ice and show that some of these kids could be saved. And then there were huge opportunities after that to improve nutrition, avoid neonatal asphyxia. We could do blood gases and do micro analyses to keep electrolytes and stuff. All these tests couldn't be done on tiny samples of blood until around the 70s. And so there was a huge opportunity to now apply what we learned from internal medicine and basic science, the physiology of the 60s, and understanding cardiovascular physiology hadn't been applied yet to babies, and it could be. And the next 20, 30 years, it was applied, and it's been fantastic. So neonatal mortality has gone from 30 per thousand to 5 per thousand. The babies I couldn't take care of when I was a house staff now reproducibly go home and live full lives. And the other was, if you take good care of a baby and they go home with everything they had genetically, their whole life in front of them, and they get better, much better than we old guys. You wouldn't believe how robust a baby is and how well they can heal and recover from real challenges. So just this huge opportunity. It's clear to me anyway.
Did you ever have a patient or an interaction during that time that gave you ideas or solidified your path?
Well, there are two. One was every child we tried to ventilate in the early days died, no matter how, what size they were, if they had hyaline membrane disease or RDS. And we had learned enough physiology. CPAP was something being discussed. The ventilator didn't work because our electronics weren't quick enough. We just hyperinflated the babies and had end-stage lung disease in no time at all. But CPAP was something you could build. And I had a neurosurgeon's child who was 2,200 grams, and now he's less than a 1% chance of dying. And I knew if we put him on a ventilator, and I was just an intern, he would die. And so I made my own prongs, got anesthesia tubing, built a bottle, and made CPAP from the literature of how to cap a chest tube, put it in the kid's nose and held it there for 3 days, mostly personally. And he went home and he's grown up and he's probably got a whole family himself now. So, and the Irish nurse who said, don't touch the baby will be fine in the morning. So being very careful, meticulous, and applying fundamental ideas about physiology could be transformative. So that was that really said, if we could solve this breathing problem, we could get a lot of children back home. And that really pushed me towards the biochemistry of surfactant.
During your fellowship in neonatology, when you moved to Cincinnati and have never left, your early publications from that time were more about calcium signaling and placental biology.
I was interested in lipids and membranes, both from a basic biochemistry point of view. And I wanted to come to Cincinnati because there was special program in adult cardiovascular. It was the apolipoproteins were being discovered, and the transport of lipids and how membranes were maintained and how proteins interacted with membranes. And I started looking, the fundamental question is, how do babies adapt to the transition to air breathing? And the placenta stops, you cut the cord, and all of a sudden metabolism, liver, cardiovascular function, the ductus closes, and you've got to breathe in the first 5 minutes. And so that was absolutely fascinating to me, the biochemical and physiological transition, and it was multi-organ. And so I started doing placental studies, but every placenta had a fetus with it. And so I saw opportunities to now begin studying lung alongside placenta. And I had my first postdoc. I said, you do the placenta now. I'm going to do the lung. He became a placental biologist. He just retired and studied the placenta his whole life. And I've studied the lung since. And it worked out fine. Essentially, I had enough. I didn't train with anybody. I didn't have it. I never did a postdoc. And part of my Appalachian upbringing is that you don't listen to anybody anyway. And that's not pejorative, it's just personality. So it was very simple. The folks in UCSF had shown that pure lipids didn't work when you gave them back to babies. John Clements and his whole team were fantastic in that era. Had given pure phosphatidylcholine. The melt temperature of that is 41.5, 42 degrees. And so I'm enough of a physical chemist to say, how do you spread and remain stable if you're crystalline or semi-crystalline at that temperature? And our babies are 36, 37, not 41, 42. So I simply said there has to be something in there that's making the lipids move and be stable. And then I did some bizarre experiments at maybe 80 cows. I got free lungs from the meat packing place down in Cincinnati. And I'd bring a whole cow lung, inflate it, wash it out, and maybe 80 dogs, 80 cows, 3,000 rats, many more mice, and purified surfactant. And if you ran purified lipid extract of surfactant on a gel, it's just a big smear. There are no proteins in there. And the literature said there are no proteins that make surfactant lipid preparations work and spread. And Forrest Adams and others had shown that an extract, Robertson had shown an extract of surfactant actually works really well, but it didn't have any visible proteins. And I said, there's got to be proteins or some weird glycolipid or something that's perturbing the packing of the lipid molecules. So I put that stuff from a couple of cows into a dialysis bag and dialyzed it for a month in chloroform methanol. Crazy. These were dialysis bags made for aqueous solutions. Nothing after a month, you still had a big smear. After 2 or 3 months, out came 2 little proteins. And that turned out to be SPB and SPC. And then I worked with Forrest, Abbott Laboratories up in Forest Park in Chicago. 82, 83, we had discovered these proteins that no one had found before or knew what they did. And then I looked at the surfactant extracts that were being used by Forrest Adams, Fujiwara, and found that those 2 proteins were in there. I purified them, added them back to the purified lipids, and lo and behold, they made great surfactants. And so these were minor publications, but that's when we had discovered SPV and SPC, made antibodies against them, got a little bit of sequence. And this is the first lung libraries. This is 1983, 84, and we had to make our own libraries. We made a Lambda GT11 expression library. And we set about cloning them, and we, lucky enough, we did, both B, C, A, and D. And then got the mice, knocked them out, found the human genes, sequence of genes, cDNA, found kids with mutations in those genes. And I'm still working on how they're regulated. We found the transcription factors that regulate their expression perinatally. And for me, the biggest question, my first grant was how are lipids and proteins turned on to mature the lung? That was 1978. And my last R01, I just started the same question, but now it's epigenetics. How is chromatin opened to allow transcription factors to now activate all the surfactant genes that you need to breathe?
In the 80s, when the clinical trials with surfactant replacement therapy, I mean, that must have been just fascinating and fabulous to watch. Can you tell me a little bit about your role during that time in surfactant replacement therapy?
Yeah, so the company, several companies recognized that I knew some secrets about proteins, and the FDA required understanding that are they going to be antigenic? Are they going to be safe? Can they be manufactured? And so I started working at 83, 84. Don Shapiro, Alan Jobe, and myself worked with Abbott in a long-standing collaboration that helped them. We had to move the preparation from Japan and from what Forrest Adams had done, that then Fujiwara used in Japan. We had to manufacture those at scale, and they were having all kinds of problems. And so I worked with Abbott to make antibodies to clone the genes, get manufacturing process that would keep the proteins from precipitating and being lost. And a lot of the preparations weren't working and weren't reliable. And we had to re-engineer it for sterility reasons for the FDA. And so we really spent 5 years working avidly with the company to build a preparation that we could then use for surfactant replacement in the United States. So I was at the FDA. Alan Jobe and I both presented at the FDA. They're non-antigenic, they're stable, they don't cause aggregates, they don't misfold and cause amyloid. And the day we went to the FDA, bovine spongiform encephalopathy hit the front page. And all of our preparations were from cows, all from the United States. So then we had to reformulate and build a whole new process, getting cows from New Zealand where there wasn't any scrappy or any bovine spongiform encephalopathy. And so that was really exciting. I worked just effortlessly with the company to get that through the FDA. We made many of the surfactant peptide and proteins and tested them, and they're still being developed for replacement. We can make them cheaper. The animal preparations work very well, but we're working on making cheaper varieties with small synthetic peptides.
So that was something that didn't escape my notice, was the number of patents that you have. Can you talk a little bit about the commercialization of your work?
Wrote patents as soon as I recognized SPB and SBC. We wrote patents on it, and then lots and lots of patents and genes and stuff. But it was new to our institution and new to biology. Can you patent a gene? Can you patent a protein? Blah blah blah. Or do you patent a process? So we, in the early '80s and '80s, I learned about that. We discovered, and TTF1 was regulating all of these genes, and it was lung specific. So I made monoclonal antibodies against TTF1 because it's diagnostic for lung cancer when you have a metastasis. You want to know it's pancreas or intestinal or lung, this antibody, and it's been used for 25 or 30 years for a clinical diagnosis. And then I made antibodies against all the surfactant proteins that have been used for all the iPSC work and all of the clinical studies now in COVID and lung injury and repair. The antibodies we made against these have been very useful for everybody. And my view is we should make them available widely and to everybody and free, virtually freely, to make sure that everyone has the technology. So we then looked at SPD, which binds all viruses, including influenza, COVID, and it protects surfactant and it's anti-inflammatory. And that was 2000, wrote a patent about SPD, and that's in clinical trials now. We're adding SPD back to surfactant replacement to see if we can block the inflammation in newborn babies who are at risk for bronchopulmonary dysplasia, which is a common, very common outcome of the tiniest premature babies. So it's in early clinical trials, phase 1, escalating doses.
And what about the cystic fibrosis aspect of your interest?
I was at Columbia, and it was a hot summer night, and I had a 5-year-old who was succumbing or dying from cystic fibrosis disease, and I spent a night with him. And it was one of these things, if you get, really makes you angry that a child should be this sick. And now we know the gene, we know the process, and we're fundamentally watching that revolution in the care of in diagnosis and care of cystic fibrosis. So I'm still working on a gene transfer to the airway, even though it's been a real uphill battle. We're looking at inteins and CRISPR-Cas and being able to deliver genes with AAV or CRISPR-Cas cassettes for the surfactant deficiency, cystic fibrosis. So there are many, many great labs making progress in the area.
Why have you stayed in Cincinnati for your entire professional career? And how have you built that program into the juggernaut that it is?
There were 60 faculty when I came. There are 850 now with about 400 scientists. So essentially, there's a great clinical program with a very large catchment area that brought babies to the hospital. So there was a huge opportunity, and there was a strong research foundation at Cincinnati Children's from the Proctor Foundation back in the 1927 or 1930 or something like that. So I saw that there was a huge opportunity that we could build science into the clinical, into clinical pediatrics in a way that really can't be done in most other places where pediatrics is a small player in a very large medical center. here, it was a freestanding pediatric department with research support from the foundation that was considerable and getting compound interest. And over time, we had the ability to invest in science. And for me, it was the opportunity to build the research buildings and to work with the administration at Children's Hospital to recruit scientists that integrate with our clinical program. We see 28,000 babies a year directly. And to me, that's a huge genetic screen. That's better than a bunch of fruit flies. We see every baby in this whole region. And we know the denominator of how many babies are born. We know exactly where they die if they're high risk. And so we have opportunities to change societal pressures that lead to prematurity or to bad outcomes in babies and mothers. And we have the opportunity to take care of the highest risk babies.
If you could not have been a physician or a scientist, what kind of a vocation or career do you think would have kept you as motivated your whole life?
I have a farm, 140 acres. That's on the Kentucky River. We have 2 eagles bonding right now. Every year they nest and you can see them from our front porch. I'm planting prairie, and this weekend I planted wild perennials, native perennials for flowers where my old barn used to be. I have a few cows. I chase them when get them back into the corral when they do bad things. And I like work. I like being outside and digging ditches. I think maybe I would have been a ditch digger.
Thank you so much for joining me today.
Thanks for having me.